Intratemporal fossa. It is an irregular space under the base of the skull, especially below the middle cranial fossa. So it is below the level of zygomatic arch, deep to ramus of mandible and lateral to the pharynx. So boundaries laterally ramus of mandible and coronoid process of mandible. Medially lateral pterygoid plate, anteriorly posterior surface of body of maxilla, posteriorly styloid process of temporal bone and carotid sheath with its contents. Roof infratemporal surface of greater wing of sphenoid, inferiorly continues with the space along lateral side of pharynx and esophagus. So here you can see laterally bounded by the ramus of mandible and coronoid process, anteriorly bounded by the posterior surface of the body of maxilla, posteriorly bounded by the styloid process and the carotid sheath and its contents. Inferiorly, the space is open and continues with the parapharyngeal space. Superiorly, the greater wing, infratemporal surface of greater wing of sphenoid, and medially the lateral pterygoid plate. So, in order to see the contents of the infratemporal fossa, we need to cut and remove the ramus of mandible. So communications, superiorly there are two openings, foramen ovale and foramen spinosum, through which it communicates with the middle cranial fossa. So gap deep to zygomatic arch allows as a passage between the temporal fossa and infratemporal fossa. So inferiorly the space is open and continues with the parapharyngeal space. Anteriorly through inferior orbital fissure the infratemporal fossa communicates with the orbit, and medially through pterygomaxillary fissure the infratemporal fossa communicates with the pterygopalatine fossa. You can see here. So infratemporal fossa anteriorly communicating with the orbit through inferior orbital fissure, infratemporal fossa medially communicating with the pterygomaxillary through pterygomaxillary fissure with the pterygopalatine fossa. And here you can see medial to zygomatic arch, infratemporal fossa is continuing with the temporal fossa, and here superiorly you can see foramen ovale and foramen spinosum, through which the infratemporal fossa is having communication with the middle cranial fossa. So contents, the muscles are lateral pterygoid muscle, medial pterygoid muscle and tendon of temporalis. The blood vessels are maxillary artery, maxillary vein and pterygoid venous plexus. The nerves are mandibular nerve and its branches, chordae tympani nerve and the otic ganglion. Thank you.